hooking into your thoracic paraspinals. That's where you want the pressure, Tim?
Yes, sir.
Okay, so I'm gonna come in with an elbow. Now, if I sink in right there, do you want more point or broad? I'm gonna give you some jostle so you can feel a little more.
Yeah, no, you're good right there.
Okay, so more side to side or up and down?
Side to side.
Side to side right there. Now what if I give you more point? There we go. I'm just gonna slowly.
Go down towards my feet a little bit more.
There?
Yeah.
There we go. See, that communication, Tim, do you know how difficult it is to get students to do that? Why is it that they're taught that the clients are just supposed to be, like, they're supposed to shut up and just let the person enjoy their massage?
Well, man, it's a hard thing because working in a clinic, I've seen that one of the highest complaints that a place will get is that the massage therapist talks too much. And they generally don't know how to navigate the conversation. You know, they don't get the cues that somebody is wanting to be quiet, or they don't know the appropriate amount. Because sometimes it's good to talk about the massage, you know, and when it, you know, pertains to the body work or something like that. But I think, you know, schools teach that. Don't talk. But
Right there, Tim?
yes.
Down?
You good.
Or a little more lateral?
Yeah, there you go. Right there.
There you go. So for relaxation work, I think more quiet. For pain relief work, I think it's just the opposite. For pain relief, I got more by going, hey, a little more lateral, a little more down. It doesn't mean we sat and discussed politics the whole time.
Right.
It just meant that I had to get more communication about what they were feeling. And for pain relief stuff, well, here's what happened. When I worked on a guy, he felt like I cared more about him because I was actively engaged and trying to give him just the right amount of pressure and just the right amount of spot to scratch that itch.
Right. So to me, it goes back to the routine. You know, if you did a routine, basically, you wouldn't have to ask all those questions. You know, if you're doing a certain type of protocol, maybe you ask, how's the pressure once or twice, which students are taught to ask that. But if you're in a routine, all you're going to do is just do your thing that you normally do. You're not going to ask, you know, hey, is this better here? That's kind of outside of what you normally do. So maybe that's one of the reasons why that communication is lost, because you're still stuck in a routine. And when you do a routine, man, you're not
connecting with the client.
No.